Welcome to Late Night Health, the radio show and online video series that cares about the most important part of your life, your health. During the next 15 minutes or so, we're going to talk about an interesting thing that, frankly, I've never heard of before. And I have to look at my notes. We're going to talk about lectins with Dr. Greg Celaya. Dr. Celaya is a functional medicine specialist, and we're glad he's able to join us today. Dr. Celaya, welcome back to Late Night Health.
Hey, Mark, how's it going?
Going very, very well. What are lectins? Let me spell that. Lectins. Did I spell that right?
You did good.
Oh, okay, good.
All right, well, lectins. Think about this. Plants really have no way of protecting themselves, or so we think, right? They just sit there and anything that wants it comes and takes it.
That's correct. Okay.
Well, they do have something. They have something called lectin. And what it is it's a sugar binding protein that can attack cell membranes. And when animals, or including us, eat it, we can have problems because they cause so many different issues. So they resist digestion, and they are basically anti-nutrients, and they can cause problems with the gut microbiome. And there's just so much more. So they're really the plant's pesticides, so to speak, to make sure that it preserves its existence.
So a bird or an animal takes a bite out of a plant and realizes it doesn't taste good. It gives it an upset stomach and leaves the main part of the plant alone.
Exactly. And it learns, right? It learns that, gee, you know what? A plant like this, I might not want to do this in the future because it can create some problems.
And what about, do we tend to eat lectins, we as people?
Lectins are in just about every food you can even imagine. And yes, we eat lectins. And lectins have gotten a bad rap. On the other hand, there's some interesting new information, but we can talk about the bad stuff first.
Okay.
They are pro-inflammatory, and they create what we call advanced glycation end products, which are devastational to us. It's one of the things that we're mentioning when we test for diabetes, hemoglobin A1C. It can also create leaky gut by binding to receptor sites. It can go to basically, I don't know, do you remember what I was talking about, molecular mimicry?
Yes,
all right.
Somewhat.
So proteins or amino acid sequences that we either don't digest or get into our system improperly can look a lot like certain body tissue parts. Meaning, for example, lectins can look a lot like thyroid tissue or even joint space tissue or joints themselves. And that can create issues, for example, like rheumatoid arthritis or any type of autoimmune disease. And so lectins are a part of that problem, not necessarily the whole thing, but they're a part of the problem.
So lectins actually, do they mimic the problem or create the problem?
Well, they create the issue. I mean, but it's not that simple. They are inflammatory. They can damage nerves. They can kill cells. They increase blood viscosity, so they make your blood a little thicker. They can interfere with gene expression, and they can disrupt endocrine function as well.
So these are something we should stay away from. Where are they found? What kind of plants or vegetables and fruits?
Well,
all of them?
They're in everything, but they're higher in certain things. For example, grains and beans and, kidney beans, lentils, black beans. I think I mentioned those, soybeans. You've got nightshades, which, you've got the potatoes, the white potatoes, the tomatoes, the eggplants, the bell peppers, the cayenne peppers, the paprika. But basically, they're everywhere. You have dairy products. You even have them in meat products because a lot of these animals eat grain, which have lectin in them and can create a problem. So, for example, if we're going to try and minimize lectins in our meats and our dairies, we want to make sure that the animal's grass-fed and not necessarily grain-fed, which can make a big difference.
Or grain-fed too. I know.
Yeah, grain-fed. Yeah, there you go.
Yes, right. But at the same time, some of those things that you've mentioned, beans, lentils, those are the backbone of a vegetarian and often a vegan diet.
Exactly. And there's been a lot of research lately with a little bit of a different concept, but you still have so many doctors saying that lectins are bad. And I think that they are bad if they're eaten in excess, just like all the rest of the food that we keep talking about. I mean, they are toxins. And for those people that have problems with them, they should try to avoid them. But other people don't have problems with them, or so we think, right?
Right.
But the new research is looking at it, and we haven't seen it in human studies yet, but they're saying they have anti-cancer type of properties.
So you're kind of, excuse me, damned if you do and damned if you don't.
Well, yeah. We have to make sure that we have a good balance of all different foods. If you're just eating, let's say, the nightshades, which who couldn't live off the nightshades, right? The potatoes, tomatoes, and so on. You may have a problem. And if you have autoimmunity, you want to try and stay away from some of these lectins to see if it makes a difference for you. On the other hand, the anti-cancer properties, they're finding out that lectins can differentiate between normal cells and cancer cells, especially in the intestinal system. But like I said, we don't have human studies at this point, but that's where it's going.
Interesting. So the lectins themselves can actually target cancer cells rather than normal cells.
That's what the research is starting to show. So you've got to be careful, because if you have a problem with lectins and you have a problem with autoimmunity, they can go hand in hand. On the other hand, you want to make sure that, I mean, those foods that we mentioned, and there's so much more, the food is fantastic for you. There's so many wonderful properties in the food. But if you eat the same thing day after day after day, and I see this every day in my practice, people just eat the same thing, you could have a problem, right?
Right.
But on the other hand, you want to be able to take advantage of all these different foods, and they all have different properties. But if you overdo, a certain type, or let's say, for example, lectins, you may have other problems arise.
I'm thinking of animals, particularly dogs. And if you have dogs, and I know you have two, last count was two. Two?
One.
Okay, one. I was talking to somebody else. They had two. So with a dog, you don't want to feed it the same food every day, because one, they get bored with it, and we do too. Isn't that true? Just from a taste standpoint.
Well, think about it. I mean, we think that we have control of our bodies, and we're thinking that we don't want to have the same food because we get bored, but really think about why you get bored, right? It's a biological issue that you get bored because your body needs variation. It needs everything you can imagine. It's like when we go to the grocery store, whoops, I don't even know how to turn those things off in the future here, Mark.
What was it?
Oh, can you hear my cell phone? No?
No.
Oh, forget it. Then we're good.
All right. Just pick it up,
Yeah, no, it's ringing on the computer, not the phone.
Oh, got it.
It's one of those.
Mine does that too.
So let me turn this off, see what it does. No, it's still the same thing. Anyway, so when you go to the grocery store, you want to make sure that you really get in there and eat a big variety of the different vegetables. I tell a lot of my patients, I want you to go in there and I want you to grab stuff you've never eaten before, and I want you to figure out how to cook it. Or maybe not even cook it, depends upon the piece of produce, and start consuming it in addition to other things in a big variety, because of not only just simple nutrients, but the antioxidant value and everything else that goes along with all this wonderful produce that we have.
I've been noticing some new things. Purple potatoes is one, and that's not really new. It's been around for maybe 15 years, and maybe longer than that. I don't know. I also noticed different greens that are related to the broccoli family. And we bought some, and I'm trying to think of what it was. I can't remember, but it looked big and green with yellow in it. And it was pretty good. We just steamed it.
Yeah, it's wonderful. And that's the secret. I mean, so when we start dealing with lectins, they've been implicated in autoimmunity, weight gain, diabetes, heart disease, dementia, arthritis, IBS, bloating, gas, and even joint pain, like we talked about, rheumatoid arthritis.
Right. So what is there a test to see if you're lectin sensitive?
There's different ways to deal with lectins. A lot of dietary challenges can make a big difference. So, for example, if we put somebody on a diet and we tell them, okay, I want you to avoid tomatoes for this period of time, and see how you feel. And then we add the tomato back to see if it makes any difference. So there's different challenge tests that are really simple to do.
With the challenge test, how long is it typical? Is it a week, a day, a couple of days, a month?
It could be any one of them, right? I mean, we may put somebody on an autoimmune protocol and they may not feel any difference for a month, maybe two. And then all of a sudden they start to really feel a difference. And then we start to add things back so we can understand a little bit about what problems they may be dealing with.
Got it.
So, you just have to also be careful on how you prepare these foods to deal with lectins, right?
Well, right. It's like a salad bar. Most salad bars are pretty healthy. It's when you add this dressing and get the wrong kind of fat, sugar, and a lot of chemicals in the dressings that there are problems.
Yeah, exactly. Like the dressings that we use are just spectacular. They're so good for you, but preparing the food. So, when you start to look at lectin content, it's basically in the skin and in the seeds. So, for example, you want to sprout your beans if you're going to do it. So you're going to soak them. Have you ever soaked beans overnight before?
I have.
Yeah, what a nightmare when you wake up and you go smell them. I mean, it's something you want to sprout, right? You want to sprout to try and minimize the lectin formation or the lectins themselves. You also want to do that with grains and seeds. You want to eat fermented foods. And another thing is cooking can reduce them, especially a pressure cooker. And for example, white potatoes, you can reduce the lectin content about 50 to 60% when you cook them.
And you do that by
cooking.
Cooking. Just cooking.
Yeah.
Okay. What about things like artichokes or Brussels sprouts, both of which are kind of hard and need a little extra time when you're roasting a Brussels sprout or steaming an artichoke?
The cooking helps reduce the lectin. So you're okay with that because everything has certain amount of lectins. Some are more than others, right? So you got the grains, you got the alfalfa, you got the clover, you got peas, right? Beans, like we talked about, chickpeas, one of my favorites, lentils.
You mentioned chickpeas. A lot of people, grind them up and turn it into hummus. I think we mentioned that a couple of weeks ago. And there are different kinds of hummuses because you can mix it with a variety of seasonings and flavors to make it different. Are chickpeas naturally good for us or bad?
They're wonderful, but if you have a lectin issue, chickpeas may cause a problem. Not always. I mean, like I mentioned to you before, weight gain is a big issue here. And I've had patients that have never been able to lose weight. And we reduce the lectin content of their diet. And all of a sudden, boom, they lose 20, 30, 40 pounds just by reducing lectins.
Wow. Are lectins found in bread? Baked bread?
They are found in breads because of the grain, and they find that white breads, because they don't have the skin or the husk on the grain, has a less of a lectin than a full grain bread. Breads are wonderful. They're fantastic. I love bread. I don't eat bread, and there's a reason why.
What about gluten-free breads? Have you tried those?
I haven't, and you know what? Once in a great while, I will eat gluten-free breads. In fact, not too long ago, we got a gluten-free sourdough bread, and I thought I died and went to heaven.
Wow.
Luckily, the place where we got it was far away, which is good. It's good for me, right?
Because you like sourdough bread.
I like bread. I choose not to eat it because of all the benefits of not eating it.
Gotcha. Wrapping up our conversation, what should people do to learn if they are sensitive to lectins?
Well, usually you're thinking that you have a problem to begin with, and it's usually patient-based, right? So we'll work with them to see if there's any type of treatments, dietary changes, lab testing that we can do to help evaluate this. Also the toxins may make a big difference, and there is so much to consider, not just lectins, but I mean, there's so many varieties of food and issues that can come from different varieties of food. But the bottom line is it's usually because people aren't eating a variety. They're just concentrating on one thing.
So those who do a low carb diet, for example, and are heavy in protein and fats, they need to be watchful too.
Well, usually, if you look at the keto diet is usually pretty low lectin. And so it's usually pretty good for that aspect. And protein's a big issue because we all need protein, but I see so many people consuming way too much protein. And consuming too much protein, you got to understand, it's not stored. If you need muscle mass, it uses it, and the rest of it is turned to sugar, so to speak.
And when somebody is concerned about lectins, they should go to their healthcare professional or call you. Because there are things that you can do to see if they are indeed sensitive to these lectins.
Yeah, it's usually people aren't concerned about lectins because they've never heard of them, nor do they care. They usually have a health issue. We find what the causes are for those health issues, and lectins may be involved in that.
Got it. Doctor, we're out of time. Thank you very much for joining us today. If you would like a free 15-minute consultation with Dr. Greg Celaya, just the way Dr. Celaya and I are talking right on the internet, visit drcelaya.com. That's drcelaya.com, drcelaya.com. And you can also visit us at latenighthealth.com. We'd appreciate it. And we think you'll find exploring around the website is kind of fun, provide you with a lot of good information. Again, a lot of information from Dr. Celaya. Doctor, thank you very much again.
Thanks, Mark. I hope you have a great day, and we'll talk to you soon.
I look forward to it. I'm Mark Alyn for Dr. Greg Celaya. We'll see you next time.